So today people get the chance to take a picture with one of these preventable things and make a promise to improve it. So, and then we'll give them a picture to remind them that they made a promise today to be a little bit healthier.
Women Heart is a national coalition for women with heart disease and women that are at risk. That's what Women Heart is all about.
Life insurance. So we represent companies like Humana, United Healthcare, Atlanta, Insurance, ING, John Hancock. Wow. Yes, and we do health, life, long-term care, Medicare supplements. So we get involved with a lot for people over 65 years old. And some direct pay benefits. So we do a lot.
Yeah, this is Take Shape for Life. This is a Habits of Health program.
Habits of Health education program where you get the services of free coach while you use our food as a tool to help you maintain your blood sugar, your insulin level, lose weight, and get a healthier life.
Hi, I'm Yvonne Green from the Centers for Disease Control and Prevention. Our focus is on prevention and keeping folks safe and healthy. So we're here today to talk about women's health and ways women can stay healthy at every stage of life.
Of Hadassah. I'm a lifetime member. I've been involved in Hadassah since the late 50s, and it's become, or it still is, one of the most important things I do in my volunteer work.
If you want to have your picture taken so that
Folks who are coming out to learn about what it is that we do here in Atlanta and with what Hadassah is doing to support the program.
It is with pleasure that we are able to host this event, and we'd like to thank Hadassah for organizing this very informative program. Thank you also to all of our sisterhood members who helped make this program possible.
Hi everyone, I'm Sue Rothstein, President of Greater Atlanta Hadassah, and I first want to thank that Sisterhood for providing this beautiful, beautiful array of food, all of the table arrangements, everything that they have done to make our morning so special. It is such an important program for each of us, and each of you have decided to make sure that you take time to learn about women's heart health and to take care of yourself, because that's the only way that we're going to be able to take care of anyone else in our lives. So thank you for being here on behalf of Greater Atlanta Hadassah and Hadassah, the Women's Zionist Organization of America. Going to start by introducing our first speaker this morning, Marcia Hildebrand. Marcia's 33-year nursing career is filled with diversity. She's worked in several states and for 2 years in Hong Kong. She became a neurofeedback trainer in 1998 and a registered hypnotherapist in 2002. Working for 7 years in adult mental health at Cobb Community Services Board, She developed, implemented, and facilitated support groups for adults with ADHD. In 2009, her passion for treating illness was taken over by a new passion, promoting wellness. She became a certified health coach and works with clients across the country, educating them on how to take responsibility for their health. She facilitates a monthly nurse support call for clients and other health coaches once a month across the country, presenting health topics and answering questions. Marcia is a charter member of Hadassah Health Professionals Group and a lifetime member of Hadassah. Marcia is passionate about making sure that people understand they are not defined by their diagnosis. They can take control of their life by taking responsibility for their health. In 2012, she became a Woman Heart Champion and Network Coordinator and works to change the disparity that exists between the care and treatment of women at risk or living with heart disease. So without further ado, Marcia Holger.
Thank you all for coming today. It makes my heart feel wonderful. I'm a woman at risk. I'm sharing my story because I don't think I'm very different from most women. This is very personal. I am a woman at risk for having a heart attack. What I want the most to prevent heart disease. I became an active participant in my health. I was excited to see my doctor and show her that my weight was where it should be. I could not wait to have my blood work done so we could both see how good the results were. It was so exciting to actually see positive results. I knew I had to pay it forward. So 3 years ago, I became a health coach. Now I coach and support clients here in Georgia and across the country, helping them. And now, I'd like to talk about my friend, Dr. Wanger, who I first met last February when I was trained as a Woman Heart Champion. Dr. Wanger is a professor of medicine in the Division of Cardiology at Emory University School of Medicine and a consultant to the Emory Heart and Vascular Center in Atlanta, Georgia. She is a past president of the American Heart Association, past governor for Georgia for the American College of Cardiology, and past president of the Georgia Heart Association. She has served as a member and frequently as chairperson of more than 500 committees, scientific advisory boards, task forces, and councils of the American Medical Association, National Heart and Lung and Blood Institute, and the Society of Geriatric Cardiology. Since 2007, she is the honorary chair of the Hadassah National Physicians Council. Dr. Wanger is a fellow of the American Heart Association and the American College of Chest Physicians, as well as a master of the American Association of Cardiovascular and Pulmonary Rehabilitation, the American College of Physicians, and the ACC. The American Heart Association awarded her the Distinguished Achievement Award, the Women in Cardiology Mentoring Award, and its highest honor, the Gold Heart Award. She also received the James E. Bruce Memorial Award of the American College of Physicians for distinguished contributions in preventative medicine and was named the American Heart Association Physician of the Year. To further honor Dr. Wanger, Women Heart has named its annual honorary awards the Wanger Awards.
I really would like to welcome each of you here. Heart health is important to each of us and to the health of our nation. And how lucky can I get being here as a 4th-generation life member of Hadassah, as a member of the Heart Association, as a founder of Women Heart, all of these groups, all into one. What I'd like to do is to tell you the good, the bad, and the hopeful. The good is that for those of us in Georgia, that over the last 20 years, women have done better. We die less from heart disease. But compared to our sisters in other states, Georgia has almost 10% more heart disease deaths for women than the national average. And I have some of these numbers here so that I can share them with you, because these are things we will correct today. Georgia women are getting less healthy. Most of them are not aware that they have modifiable risk factors, things that you and I can do each day. Did you know that 27% of Georgia women have high blood pressure, 37% have high cholesterol, 27% are obese, 60% are not physically active, 19% of Georgia women still smoke, and most women are unaware of their hearts. We must take charge of our lives and of our heart. Now, you have an owner's manual for your car. You have an owner's manual for your washing machine. And what I was concerned with is that no one has given us an owner's manual for the heart. And that is what we will do today. This is Wenger's owner's manual. What are the technical specifications of hearts and features? Well, your heart's a muscular pump. It's just a little bit larger than a clenched fist. It weighs less than a pound. But it beats over 100,000 times every day, pumps 2,000 gallons of blood, nearly 5 quarts of blood every minute. It's a hard-working pump. And it pumps that blood through 60,000 miles of arteries and capillaries and veins. So that's what we're dealing with. That's the mechanics of our material. And the warranty as of 2000, if you read and follow the owner's manual, is about 81 years for a Caucasian woman and about 77 years for a black woman. But you have to read the owner's manual carefully for the operating instructions. And the whole concepts are just what we're doing today, empowering women through awareness and education. And the message, if you come away with just one thing from today, is that favorable lifestyle changes can decrease your cardiovascular risk and decrease your disease. Of your blood fats and of your blood pressure. And this is one of the reasons. In these bars, the women are in the yellow and the men are in the orange. And this is 30-year events in the famous Framingham Heart Study. And you can see that if you're a diabetic woman, you do worse than the diabetic men. Total heart disease, coronary disease, for heart failure. Diabetic women are much more likely to develop heart failure than diabetic men, and for problems with the legs. So the diabetic woman very much at cardiovascular disadvantage. So precise risk factor control. Now here's a very interesting research study done in the United States. And this was a very average American population, overweight with some abnormality of glucose tolerance. And all that they did was to exercise for 30 minutes a day and lose only 5 to 7% of their body weight. And they reduced their risk of developing diabetes by 58%. If somebody said you could keep from developing diabetes by exercising 30 minutes a day and by losing weight, that really is certainly the thing to do. And what we are seeing in the U.S. is the epidemic of diabetes, as I told you, is related to sedentary lifestyle and overweight. Informal questions and answers later on, but we have a program to do next.
In June 1990, Nancy, a nurse, co-founded the Hadassah National Center for Nurses Councils, to which the Hadassah Professional Councils of Atlanta is related. It is the first and still the only national professional organization for Jewish nurses. She currently serves as chair of the advisory board of the Hadassah National Center for Nurses Council, whose members include nursing deans, directors, and prominent researchers in the field of nursing and other fields of medicine. With the support of more than 5,000 members of the Hadassah Nursing Councils, Nancy spearheaded the successful effort to create and fund Israel's first academic clinical master's program in nursing at the Hadassah Henrietta Zoll School of Nursing in Jerusalem, a program that is now 12 years old. Also in the community, Nancy is a former vice president of the New England Zionist Federation and former treasurer and vice president of the New England Jewish Community Relations Council. She was elected to the executive board of the New England Anti-Defamation League in 1991 and the Women's Division of Combined Jewish Philanthropies in 1996. She currently sits on the boards of the Jewish Telegraphic Agency and Young Judea Global. Nancy is married to Dr. Kenneth Falchuk, and she is very proud to be the mother of Brad Falchuk, co-founder of the hit television show Glee.
And American Horror Story. And American Horror Story.
And American Horror Story, right. And two other highly successful children, as the mother of more than one child. You can't. Two other highly successful children and 5 grandchildren. Nancy, we are pleased and honored that you added this visit in Atlanta to your very busy schedule. We are eager to learn more about your most recent Hadassah initiative, the developing relationship with Sister to Sister, and the establishment of the Linda Joy Pollan Cardiovascular Wellness Institute at the Hadassah Medical Center in Jerusalem. Nancy, welcome.
And Rachel, I think, was one of the, I know Nanette is the honorary chair of the Physicians Council, but you were the first chair of the Physicians Council. That's correct. And I want to say that here at Atlantis, I saw Vicki DeGroot. Is she still here? Yeah. I remember coming down here to start the Nurses Councils, and you've proven it to be one of the best pilots we ever did. Because if I look at today's program, and I listen to Marsha, and I certainly to Rachel and all of you that have put this program together, it validates not only that we can change people's lives here in America through healthcare, but also that we can build bridges to Israel through medicine. So, kol hakavod, and I chose to come down here. I looked at the program that Lee sent to me, and what your presidents have done, and all the organizers, and I said we were doing this national initiative with Sister to Sister, and I said, you know what? I'm coming down. Susan Gurley from Sister to Sister said the same thing. You are really, truly, once again, a role model for what I think we're going to model after for the rest of the country. One other piece of breaking news, because Rachel talked about the first clinical master's program at Hadassah in Israel. Well, as of yesterday, before Shabbat, Friday actually, we have the very first professor of nursing in the state of Israel at our school. President Kaiser was given that award, and I'll tell you, this is an HWZOA labor of love. That School of Nursing is ours. What all of you have done to support it over the years, her professorship comes from money you raised to help send her to school for a PhD, and all the nurturing that we've given her from here in America. So again, great celebration of everything that we do. How many of you were in Israel in October? I knew I saw a lot of you because you came up, and I remember we all celebrated in the B'nai Alma 100 years of Hadassah. How many of you know that we are the second largest employer in the city of Jerusalem? Pretty powerful. And you saw that in the building. Well, what goes on inside of that building is taking care of patients with quality care, the standards that we want. We've been innovators and pioneers. And so it is with the Linda Joy Poland Cardiovascular Wellness Institute that was created by Mrs. Irene Poland from Washington, D.C. And she did it in memory of her daughter, Linda Joy Poland, who she lost at 16 years old. And Mrs. Poland, I know that Susan will speak to the program of Sister to Sister, but Mrs. Poland really didn't know Hadassah, and in fact was reached out to by many hands. And there's a story in this, in that she had created Sister to Sister 13 years ago, I think it's 13 or 14 years ago, in order to change women's behavior, to empower them and educate them to change for their cardiac wellness. And she created just one center in America, the Brigham and Women's Hospital in Boston. And when someone talked to her about doing something in Israel, she didn't think about it. Until the ambassadors from Israel came and talked about Hadassah Hospital, until the people that were in Israel that she knew through her connections in Washington said, what about Hadassah, the organization and the medical center? And I'm the one that got the phone call in my den from Mrs. Irene Poland, who said, Nancy, I'd like to give a gift of $10 million. Then I picked myself up. $10 million to create this cardiac wellness center in memory of my daughter. You know, there comes a time where you meet very special people. You have a brief, very brief bio of Susan from Sister to Sister. She only started 4 weeks ago. Her first experience was coming to the Hadassah National Board meetings, if you can imagine.
Through the real-life screenings, they were also being given information from dietitians and nurse practitioners and doctors about what they could do, not you, but the person who was getting heart screened, about what they could do to change their behavior. And Dr. Wenger said it, it is really, it's in your power. It's exercise, diet, changing lifestyle. Become educated. If you are not educated about heart health, it doesn't matter what the doctors say, it doesn't matter what happens, because you need to be a partner. As Dr. Wenger said, you are in partnership with the doctor. But that is self-knowledge, and that is actualizing change.
For people without symptoms. There are many tests that are not recommended for people without symptoms. But if a woman has symptoms that might lead the health professional to think that there might be heart disease, a stress test is appropriate.
To Echelon Sisterhood, you have done just a great job. Thank you so much. I know she's played a fairly low-key part today, but Lee Tannenbaum, co-chair of this program, thank you so much to put together all of this. And I don't think that Nancy and Susan would be here if it wasn't for you really looking out for what's happening nationally and not just locally. But Lee, we want to thank you so much. And our Heart Health Champion, Marcia Hildebrand, we want to thank you for giving us your personal story and all of your Heart Health Champion. Susan, we are so thankful that you joined us today. This partnership with Sister to Sister is going to be, I can tell, a really long-term partnership, and we are all going to benefit from that. Vice Guest President Nancy Palsha, thank you so much for being here. We did start the ball rolling, and something that can be replicated around the country. And thank you so, so much for being here and all you do. Annette, our local hero, champion. We have a special certificate for you, but aside from that, Lori Sugarman, Vice President of Fundraising, along with Zinni, has actually composed a poem. So we have your certificate.
Hadassah honors with heartfelt gratitude Dr. Nanette Wanger for her consistent rhythm and circuitry of a lifetime, her passionate intervention, research and education in matters of the heart for women, for discharging a new paradigm within the medical community that oxygenated fresh thinking into matters of the heart for women, for her lifetime of dedication to the symphony of electrical impulse, the rhythm of the valve quartet, the muscle of all life, that which beats against the hands of time, that which pumps through the boulevards of pain and pleasure, loneliness and elation, love and resentment, life and death. That which pumps through the boulevards of self-destruction, ignorance, self-preservation, and incessant commercial messaging. On behalf of the muscle that beats in our mothers, our daughters, our sisters, our aunts, our grandmothers, our granddaughters, our cousins and our friends, Greater Atlanta Hadassah and the Health Professionals Group honor the lifetime achievements, devotion, research, and education of Dr. Nanette Wanger in matters of the heart for women.